There was a big healthcare announcement today, so let's break it down. So the administration wants to restructure how healthcare dollars are flowing in this country, meaning instead of payments going straight to insurance companies, the idea is to send that money to you so you can shop around for your own coverage. If this works as planned, then the big win here would be successfully putting power back in people's hands. And some other countries are already doing this. But the difference is that these other countries have price controls and certain regulations built in to keep costs from spiraling. And in the US, if we didn't have those safeguards, then what if insurance and drug companies just raise their prices up knowing people have more cash to spend, and we're effectively right back to where we started. Now shifting gears to prescription drugs. The plan wants to negotiate prices down so they match what other countries pay, and if this happens, it would actually be huge, because Americans pay some of the highest drug prices globally. And so the administration has been working on deals with pharmaceutical companies, and they're also pushing to make more medications available over the counter, so you can just skip the doctor's visit for the routine stuff. And again, if it happens in this exact way, then your medication will cost much less. But the important part here is that this requires Congress to actually pass legislation, and this is always where things get complicated. Also, real quick, if you're finding this breakdown useful and want to stay updated, then please do subscribe. But I think the transparency angle here is probably the most straightforward piece of the puzzle. And in regards to transparency, this proposal will require insurance companies to show you exactly where your premium dollars are going, and how much of them is covering actual healthcare versus how much is becoming profit in their pockets. They'll have to publish their claim denial rates publicly, and they'll also have to publish how often those denials get overturned if you ever choose to appeal. Hospitals accepting Medicare or Medicaid will be required to post all their prices publicly so you can compare costs before you decide on treatment. So it's kind of like checking a restaurant's prices before you decide to walk in, except it's for medical care. And so the big question right now is, will any of this actually lower costs, or will it just shuffle money around while prices continue to stay high? And this depends entirely on if Congress acts and how companies respond, and whether these promises actually get enforced into action. Thanks for watching.